Hello, and welcome to the latest episode of the Amplify podcast brought to you by AIM Youth Mental Health. My name is Sophie Chang.
And my name is Sneha Dhavale, and we are AIM Youth Ambassadors. We're so excited to be interviewing Dr. Shashank Joshi, an AIM Scientific Advisory Board member and Stanford professor, as part of our AIM interview series. Welcome, Dr. Joshi, and thank you for being here. Could you please start by introducing yourself?
It's wonderful to be here with both of you. I'm Shashank Joshi, and I am a professor at Stanford. I work in school mental health. I've been there 26 years, and over time, my roles have evolved. So, my three latest roles are as a program director. So I raise future pediatricians and child psychiatrists. I work in the community in schools and I focus on suicide prevention. And I also work on the Stanford campus in the vice provost's office and I focus on academic well-being. So I bring tools for students and for their RAs in the dorms and for faculty and staff to be able to open the doors to conversations, especially related to mental health and difficult topics. And it's part of an overall initiative at Stanford around coping skills to help people have important conversations, even when the topics are difficult or even when the disagreements are pretty known. So that's my latest project. But those are the three things that I'm involved with now. And I really enjoy interacting with the AIM Ideas Lab because whenever we're doing youth mental health and we have youth leading whatever the initiative is, I'm all in.
Thank you. That was such a great introduction. We're so glad to have you on the call today. For our first question, we'd love to know what got you into mental health, specifically student and youth mental health.
Sure. Well, so I described the training program that I am leading now. It's called Triple Board. And the triple refers to three areas: pediatrics, general psychiatry, and child and adolescent psychiatry, which is the way that I was raised as a doctor in the 90s. And school mental health was the ultimate convening of those three areas. Raised as a pediatrician first, so I always think about prevention and health promotion. And even as a psychiatrist, I think about prevention and health promotion. So schools are the place where young people have the opportunity to not only learn how to think and learn how to do that with one another, but also learn about their health, their emotions, and hopefully come to the idea that mental health is part of overall health. And our students have to be healthy enough to learn, and our teachers have to be healthy enough themselves to teach with the tools they need to reach all of the students in their classrooms. These days, 20 to 25% of our students are really struggling because of mental health issues. And so we need to equip teachers with the tools to be able to open the doors to those conversations so they can identify when a student's in distress and know how to refer. Most of the time, teachers just need to be teachers and be themselves, and they will cultivate those trusting relationships. But sometimes teachers don't know what to say if a student's in distress. They don't want to say the wrong thing, so they don't say anything. And then the student doesn't feel seen and heard. And so I found the work in school mental health to be the ultimate combination of prevention and intervention and the sharing of resources. The other thing that we like to think about in pediatrics and child psychiatry is that, in particular, child psychiatry is family psychiatry. So whenever we work with young people, we're also engaging with their family, we're also engaging with the community. And as a program director raising future doctors, I really like to help them think about systems of care because children do not go to school in a vacuum. They live at home. Hopefully, they're at home with one or two parents or other trusted adults. They live in a community. They live in a neighborhood. They hopefully have some healthy activities that they're engaged with. So these are the reasons why I really like hanging out in schools as a big part of what I do.
That's really great insight. Thank you so much. What emerging developments in youth mental health do you find the most promising?
Well, there are several developments that are coming up that I'm really hopeful can make a difference. I do think that as much as social media and social channels are blamed for a lot of what we would call a youth mental health crisis, I also think that social channels and social media can be a really important part of connection and of coping. There are a lot of online tools now that have been developed for youth by youth that are research-based, that have clinician oversight, or that are, say, mediated. Some of the chat rooms that are mediated by clinicians. The state of California has come up with two really wonderful resources. One of them is Soluna, Soluna, which is a free app that you can download where you can get connected to a well-being coach. And Never a Bother, the website that invites 12 to 25-year-olds to get online anytime to connect with a counselor. Because whatever question you have, whether you're worried about yourself or a friend, whether you're just really stressed about something and you need an extra set of eyes and ears, you are never a bother, which is why they named it that. I think the youth mental health movement has produced these innovative models that have come from other places. For example, in Australia, there's a very well-studied and successful model called Headspace, and that's different from Headspace, the app, although I think that's a wonderful app as well for coping and well-being. But Headspace is a integrated youth mental health service model where a young person can go into a center and they meet with another young person, typically a young adult, like someone between 18 and 25, or it might be an older teenager, who just tries to understand what's going on for the young person and then directs them to either a mental health clinician, a primary care doc. If they are housing or food insecure, they can get services for that. They can get job training. And it all happens in one place for youth ages 12 to 25. They don't need their parents' permission. They don't need to have insurance. And these centers are now being started in the United States, starting in California. And in California, the name that the young people came up with is Alcove, all lowercase, ALLCOVE, like a cove where you can go hang out. You don't have to go for any particular reason. You can go do your homework, meet up with your friends. It's for all of us. It's for all youth. And so that's the name Alcove. I think those are coming, they're going to be coming pretty quickly to other places in the United States. And I think that's a really great model. It's funded by the state as well as by some other sources. I think the applications of psychotherapy techniques that we know work for coping with stressful times, when you're going through a difficult time, and also when you're just trying to cultivate some healthy habits through treatments like DBT, dialectical behavior therapy, and adapted DBT skills, which we have now been using in high schools and middle schools and on the college campus. One can learn the skills for emotional problem solving, not just when there's a crisis, but really when there are just kind of the ups and downs of life. So I think those are several really good developments that are already making a difference to hopefully make a dent in this youth mental health crisis that we're experiencing.
Thank you so much. I for one am really glad to hear that youth mental health spaces and resources are becoming more prominent. I really think that it's one of the great things that technology has offered us. You talked about the duality of social media and how a lot of people see it as a bad thing, but then it's also a way to bring initiatives like AIM Youth Mental Health to more people and for it to be able to access a greater audience. For our next question, have you learned about one myth you think about suicide or youth mental health that you wish more people understood?
Well, probably the myth that comes up the most in suicide prevention work is the idea that asking about suicide somehow places the idea in a young person's mind. So not only is that not true because young people are surrounded by social media all the time and there's information at your fingertips. So the word suicide, between how it's portrayed in the media, between how famous people have taken their lives, unfortunately, and it gets covered in the media, to the way people think about their own mental health and maybe access services, where when you're in a crisis, one of the things we try to do, for example, with the 988 number, is to make sure people know that there's a national crisis line available 24/7. You can text or call 988 if you or someone you know is in a suicidal crisis. So this is a term that is now part of our young people's vocabulary. In fact, we have several research studies showing, I would say since about 2014, so about over the last 10 or 11 years, that asking about suicide not only does not increase the risk of someone making a suicide attempt, it in fact can decrease the risk because you are opening the door to a conversation. We know that from research studies where they actually take people who were feeling this way and who had intentional messaging and someone sitting with them and asking them whether they were feeling like harming themselves or taking their lives, compared to those who don't get such interventions, where they don't have an opportunity to talk about it. And so we know that talking about it is not only safe, it's very important, can even save lives, because again, you are opening the door to a conversation that that young person probably is ready to have. So I think right now that's probably the most important myth we deal with. And so in our Herd Alliance toolkit, which you can find at herdalliance.org, HERD is an acronym for Health Alliance in Response to Adolescent Depression and Related Conditions. Roughly, it's HERD, like I heard you. And our logo is an ear for listening, and the color is green for life. And that logo was actually designed by a young person during a pretty difficult time in our community in Northern California where we were losing several people to suicide. So the Herd Alliance came together as collaboration among school staff and school leaders, mental health clinicians, and primary care clinicians to be able to address the crisis we were having at the time. So about 25, 30 people came together. We created this toolkit. Next, we placed it online in the early 2010s. And now it gets accessed, a couple 100,000 times a year. People use the toolkit, they use the tools, they use the resources. It's essentially a convening site for best practices for health promotion, mental health promotion, that is, crisis intervention, and postvention if there's a loss, and there's a number of ways to access the resources. We have a toolkit that is lengthy and very complete, and we have a website which is live now, but which will relaunch on September 29th, 2025, herdalliance.org. And so I think that that's a place where you can read more about myths and actually read about some research studies that show how one can safely message about mental health and suicide, not only when there's a crisis or as part of postvention, all the things that happen after a death, but in particular in the times when things are going well. So the idea, again, that we think about health, we think about physical health, but we also think about mental health. We also think about spiritual health. The idea that we have an inner life, we're connected to something larger than ourselves. It could be Mother Earth, it could be a religious system, it could be a higher power, it could be questioning. But we know from numerous studies over the last 20 years that young people believe in the idea of spirit and a spiritual life, even if they're not part of a formal religious system. So we ought to be tapping into that to find out about the inner lives of young people. So when we talk about health, we talk about these domains, and that's one of the reasons why we want to have online tools available for people to really talk about these issues early and often.
I think, like you said, building a community and establishing communication is very important to breaking stigma around mental health and suicide. Based on what you said for your toolkit, what's made the biggest difference in schools and students?
Well, I think one of the things that makes a difference is if there are a group of students such as yourselves who come together, especially if it's in school leadership or if it is what we call peer leaders, opinion leaders, thought leaders on a campus who are really going to these mental health convenings, whether it's part of a mental health interest group like Bring Change to Mind, or whether it's part of something like AIM Ideas Lab, where you're really creating the science. You are actually bringing the research ideas to your peers and then to the scientific advisory board. And you are highlighting the things that are most relevant to young people now. I think when students get together and highlight the issues that are most relevant at a school board meeting or with the principal or with the principal's administration, the senior administration, or with the PTA, people pay attention. And I think highlighting youth voice is something that has really helped us in the development of the toolkit. And I think that's been a big difference for schools compared to when the toolkit came out, because we have found, because it lives online, that young people go to the toolkit and they sometimes educate themselves about the best practice before their administration does. So now a lot of these research studies, they're one click away. And so if you want to show your administration, well, here's what we really need to be doing around messaging when we lose someone in the community. This is the best practice. We can't not talk about it. We have to just be talking about it intentionally, having grief spaces, having the adults here sort of convene what we do and direct the messaging that occurs after a tragedy. So I think the biggest difference has been young people owning their place in this when it comes to youth mental health.
Yeah, I agree with you. And I really think that student-led initiatives are so much more powerful, especially regarding youth mental health. Since you've had been so involved, the intersection between schools and student mental health, I'd love to hear about how schools' approaches to mental health have shifted over the years, as I feel like mental health is becoming like people are becoming more aware of how prominent of like a, how important it is.
Yeah, I think the school's approaches now, schools that really understand that if you have a community of, for example, in the community we live in, we have two comprehensive high schools, public high schools, we have two private schools, and then we have a number of, say, non public schools. Schools as small as 100 to 200 students to as large as 2,200 students. Having peers learn best practice, having peers get trained in things like teen mental health first aid, or inviting in and getting trained and investing in evidence-based peer leader programs or mental health education with peer leadership programs like Youth Aware of Mental Health or YAM, or Sources of Strength. These are two of the most robustly supported school-wide suicide prevention strategies in the country. They are designed to be implemented. They are not hard to begin, but they are somewhat challenging to maintain, because when there's a loss in a community, everybody comes together. There's a lot of energy to do the right thing, to do something, and to make sure it's carefully chosen. Choose a program where it's youth-led, where there's evidence that it can actually connect kids to trusted adults and even lead to decreases in suicide attempts. And then after a while, sometimes administrators want to not talk about suicide anymore, want to see the risks of what our young people face, including suicide risk, in the rearview mirror. That happened last year. Can we just not talk about it anymore? Well, you all know, you might be driving, or if not, you'll soon be driving. In the rearview mirror means there's a little message in the rearview mirror, which is objects in the rearview mirror are closer than they appear. So even though something might have happened last year or the year before in terms of a mental health crisis or a suicide in a community, we know that there are many other suicide attempts that we just don't hear about. So we have to always be proactive in promoting mental health, and we have to be looking out for one another. This is Suicide Prevention Month. It's September, and we have to remember that talking about suicide responsibly is a really important part of suicide prevention, and coping with suicide loss and grief in an intentional way that follows what's an effective way to do that is an important part of what we call postvention, and also prevention of the next death. So those are important approaches that schools have begun to adapt.
I think your analogy of the rearview mirror is really great, because it shows that, like, just because, like, it's really great.
Analogies are very important for the work we do because, for example, we work with different cultural communities. And in some cultures, like I'm a child of immigrants, and at the time my parents were growing up, they immigrated from India. There really wasn't a language to talk about mental health. And even now, in some communities in California, 40, 50, 60% of the students are either immigrants or children of immigrants. So how do we try and bridge that cultural gap between what a parent's understanding is of mental health challenges and how they can get in the way of development, social relationships, and even academics for a young person, and what the young person understands that to be? That teenager might want to go for treatment. They might want to get school-based treatment, and the parent might not understand what that is. By the way, that's not only unique to immigrant communities, but I would say in communities where mental health is not really part of the language growing up, it's really important to understand, well, who are the trusted adults in this child's life? We've got to bring them on board. We have to meet with them individually. We have to help them understand why it's important for their child to be able to access help and services. We might even need to bring in a cultural broker, someone from that community, whether it's an immigrant community, whether it's a faith community, or another community that really is unfamiliar with mental health treatment, what it involves, what the benefits are, and what some of the barriers are for young people to get access to that. So when we introduce something in schools, we want to make sure that people know why we're there. As a psychiatrist, I don't think about medicine as the first intervention. That's another myth. We go into the field of psychiatry because we want to become doctors of the psyche. We want to really understand how do we apply what we've learned in school about the mind and about relationships and about behavior and cognition. And most of the treatments that we bring to young people don't start with medication. They start with talk therapy. They start with first reflection and understanding what this young person's struggling with before we go right to medicine. Now, we are experts in medication management when that's necessary, but we don't really manage meds. We use medicines as a tool in our overall treatment as we try to understand a young person and connect with families. And so that's sometimes a challenge for schools to understand what's the role of a psychiatrist, but I think there's a lot of opportunities. And in our training program at Stanford and in places like UCLA and USC and UCSF and UC Davis, we have very robust child psychiatry training programs that also include a school mental health component. In fact, all the child psychiatry programs nationally do this now as part of training to understand the psychiatrist's role in schools and also to understand their patient's life outside their office. The child goes to school as like their full-time job. So we need to understand, well, who's part of that full-time job? Who are their trusted adults? And all of these issues are very important. Not only who are their trusted adults, but who are their friends? And do they feel a sense of belonging in their school and in their community? We know a sense of belonging can be protective against suicide. We also know that a disrupted sense of belonging where you feel like you don't belong in a community or you can't just be who you are, that can be a risk. And so one of the measures we do is try and get a sense of belonging from that young person if they feel like they're part of a community, whether it's a school community, a cultural community, or even things like being on a sports team or being in a club where they really feel like they're part of something bigger and they can be themselves. I think these are all really important domains of what we're learning right now in youth mental health. And what advice I would give to people like you who are interested in perhaps a career is continue to get engaged in the things that you are most interested in, especially if you have a personal connection to it. Because that, say you had a friend who struggled or a sibling who struggled and you found that, well, there was a treatment they got that really made a difference. Well, try to learn about that treatment. Try to learn about what are the things that help them get better and share that experience. So one of the things I can say before we end here is people often ask me, how do we defeat stigma? I don't know if we'll ever defeat stigma because stigma is a cross-cultural phenomenon. Stigma does not discriminate based on your household monthly income or where you or your parents are from, where you grew up. Mental health stigma is still pretty strong. But the way we can defeat it is we have conversations like this. After someone watches this particular video, if there's something that was interesting to you, tell someone about it, post about it, have a conversation. That is how we defeat stigma, one conversation at a time. But before we finish, I want to ask each of you, Sneha and Sophie, how did you get interested in the AIM Ideas Lab? What is it that engages you in this work of mental health promotion? Sophie, do you want to go first?
Sure. What got me interested in youth mental health was I've been a competitive swimmer for a really long time. And as an athlete, I've seen so many of my friends struggle with their mental health, especially at competitions. And then recently my school's suffered a series of mental health tragedies that really made me want to do something about it and become kind of what you talked about earlier, involved in student-led initiatives at my school. I started a mental health club at my school, and here we are.
Thank you, Sophie. Well, as Dory taught us, just keep swimming. Very important.
That's Finding Nemo.
Yes, Sneha.
What got me interested in mental health, I guess, would be I moved just before high school started. So the change in completely finding new friends and adapting to a completely different competitive school. It was a lot, and I felt like everyone in the school also, not because they moved, but they academic pressures and whatnot. Everyone has their own story going on, which we can't always see. So I felt like based on my experiences, I wanted to help other people who might be going through the same things, but may not be making it as a parent.
Wow, very compelling. I'm so glad you're involved with this work as well, Sneha. Well, thank you both for this great opportunity, and I look forward to hearing more about what the AIM Ideas Lab will be developing this year. And thank you so much for having me as part of this series.
Thank you so much for your time, and we're so excited to see all that you continue to do for youth mental health. It sounds like you're a very busy person.
Busy person, but I don't do this work alone. I always work in teams, and that's something I remind people. It's very important when you're doing this work. Really, the heavier the work, the more important it is to do it together. So I have amazing colleagues in my department, around the university, around the country, who really think through some of these issues with us so that we can hopefully find some answers as we do this work.